This afternoon, we're continuing our coverage of National Suicide Prevention Month, and joining me now to speak a little bit about local prevention efforts is Shaylee Dehar. Thank you so much for being here today.
Yeah, thank you for having me.
And you're a data analyst at Mesa County Public Health, so tell me a little bit about your role.
So in my role, I get to explore local data about our community that helps inform policy and action to benefit our community.
Perfect. And you also just released the annual suicide report for
Yes.
Mesa County Public Health. So tell me why this is so important for our community.
Yeah, well, it's really hard to improve something that you don't measure. So we make a point to track this data annually so that we can see the significance of our prevention efforts and how that improves the lives of our community. We also make a point to regularly release this report so that we have a way to talk about this issue without currently being in the midst of a loss.
And what are some key findings in that report for last year?
Yeah, so over the last few years, we have seen a loss of about 50 residents each year to suicide. And that means that that is the 7th leading cause of death for our county. Each year, thousands of residents in our community are impacted directly by suicide, whether it's a death, an attempt, or ideation. But the good news is that we also have thousands of residents in our community who have participated in some of our free suicide prevention trainings through our Suicide Prevention Coalition since we started it about a decade ago.
And is there any insight into what is driving suicide in our community specifically?
Yeah, so we track a lot of different measures to help inform our strategies for prevention. And some of the things that we have seen is that we continue to see the highest fatality rate among working age adults. We also have seen a higher fatality rate among men. The death rate among men is 3 times higher than it is among women. And then we also continue to see a high involvement of firearms. Over half of suicide deaths in our community involve firearms.
And this report helps build out local prevention efforts, so tell me a little bit about those.
It does. So in our community, suicide prevention is a shared goal among leaders across every sector of our community. The Suicide Prevention Coalition brings all of those leaders together to coordinate strategies that address a wide variety of risk factors. It's important to remember that suicide doesn't result from any singular factor. Multiple factors stack together to lead to complex circumstances that can lead to suicide crisis. So it's really important for prevention strategies to address a wide variety of risk factors to decrease the overall burden in our community.
Absolutely, and if anyone at home is interested in finding more resources about suicide prevention, where can they head to?
So first, if you or anyone you know is currently in suicide crisis, please call or text 988 to connect to the Colorado Mental Health Line. And then you can also go to our website to find the right fit to explore local mental health resources to fit your unique healthcare needs.
Okay, thank you so much. I really appreciate you coming on today.
Yeah, thank you so much.
And we will be right back. Don't go anywhere.